Well, hello everyone. This is Larissa with Mountain Pacific. I welcome you during this awesome Wednesday afternoon. I hope you're having a wonderful week. We're going to get you started here on It's Worth a Shot. I think we have mostly everyone entering. So if we can go ahead and move on to the next slide, that would be great, Mary. All right. So as always, please feel free to add any recommendations or ideas for any future topics for our It's Worth a Shot in the chat, or feel free to email any one of us. We will continue to meet every Wednesday here with our team and our welcome, amazing providers and presenters. So today, if we can move on to our next slide, I believe we have a polling question. So if you all could please answer the polling question, that helps us in continuing to provide some awesome educational pieces to you all. Looks like we're getting up there. Are we good, Mary? All right, so if we can.
Okay, we'll go ahead and end it.
All right. So if we can go ahead and move on to our next slide, Mary. All right, so today we're going to start out with having Kyla. She's one of Mountain Pacific's account manager, and she's also a pharmacist. She's going to give us a live presentation on this map and what it is looking like for COVID-19 within the US. So I'll pass it on. Thank you so much for being with us, Kyla. I look forward to see what you have to show us.
Thank you so much, Larissa. I'm happy to be back presenting for the whole time today. So hopefully you're not sick of my voice by the end. So this week, what I wanted to do, we do this update every week, but the website actually has the ability for you to toggle between different ways to kind of look at this data. So I wanted to actually show a live screenshot of how you can look at the data differently. Mary, thank you. Okay. So this is the COVID tracker that you can access online. They do update this every Monday and Thursday. And just to confirm, you guys are seeing this, right?
We are,
Yes,
Kyla.
we are. Yes.
Okay, so as you can see, we've kind of been presenting these trends in hospital admissions and deaths. Every week, we are seeing those go up fairly significantly. So that's why it might be advantageous for us, since things seem to be changing pretty quickly, to be able to look at different views. And we can look at our states, we can look at counties, or we can just look at a raw count, as you can see here. So if you look at the counties, it's kind of like a lot of colors to look at. And so if you toggle here up into state, and this is for hospitalizations, and you can see here, you can toggle these other kind of outputs. Look at Montana. So we saw, and this is a 20% decrease in the last reporting period for Montana. But then if you look at Wyoming, we are actually seeing a greater than 20% increase. So you can see this data is fluctuating quickly. And I think this is a really good thing to have on your radar, to be able to check in with what's going on in your state. And then if you want to toggle to that county level as well. And then you can see up here at the top, you can look at hospitalizations, then you can look at deaths, then you can look at emergency department visits. So play around with that a little bit. I do think it's a really good tool to help us as we move forward into potentially kind of our fall respiratory surge season. Okay, so we can go back to the slides. Mary, thank you. And please, if there's questions that come up along the way, just throw them in chat or go ahead and ask your question. I am totally good with being interrupted. Okay, so I am going to cover some immunization updates, and I'm really going to only go over pneumonia, COVID, and influenza updates today. And I didn't cover a lot of the other kind of small little changes we've seen, but just hitting those kind of top 3 respiratory illnesses that we're going to see this fall. You can go to the next slide. So just a reminder, and we had talked about this at the beginning of the month, but it is National Immunization Awareness Month. And so this is a good time for you to utilize resources to get information out to your patients. Their webpage has a ton of resources, including videos, toolkits, having patient conversations, vaccine hesitance, kind of all the things, and really good resources. So I would encourage you to take a look at some of their stuff there. And we can go to the next slide. So I put this quote in here today because I thought it was very fitting for just kind of what we're looking at right now. So this is from a gal that does a blog, and she also does, I think, maybe like some podcasts, and she's your local epidemiologist. Caitlin is the main person that does this podcast, and she has really good information. And so this was a quote that was put out actually in the Alaska Hospital newsletter this week, but I thought it was really telling. So it's the first time we have vaccines for all 3 fall respiratory viruses that hospitalize and kill hundreds of thousands annually. So I just wanted to start out with that as we're moving through and looking at the vaccines that are available. We can go to the next slide. So this is kind of the most exciting, I guess, news to bring forward that everybody is probably already aware of. These 2 RSV vaccines have been approved in adults, and they are in our pharmacies. People are already receiving these. And this is really exciting because they're very effective. So the efficacy was 82 to 86% for these vaccines. As of now, they're going to be a 1-dose vaccine, but we don't know if that could change in the future. So that's how it stands now, but we'll see how they stack up as far as if we're going to need additional doses. And what they're saying, CDC is saying this should be offered as soon as available, which is now for our patients that are 60 and older that are higher risk. If we look at patients that have additional risk factors other than their age, so we're looking at patients that might have COPD, heart failure, any kind of lung dysfunction or risk factors like smoking. Those just additionally put them at higher risk of RSV and RSV complications. And so it is important that we talk to our patients about the vaccines. We can go to the next slide. And I will actually look at each of the vaccines that is available. So Arexvy, I'm sorry, I'm still learning how to say these. Even though I'm a pharmacist, I still can't say the names of the new drugs for a while. So Arexvy was the first one that was approved. They both require reconstitution, and Abrysvo was the second one approved. And I just put a list here of the adverse events that go along with each one of these. I thought it was very interesting that Arexvy has a much higher percentage of injection site pain. So it was 10.5% versus 60.9%. So I thought that was really kind of interesting because there's not a lot of difference in the vaccines themselves. But as you can see, kind of the things that you would normally expect after a vaccine: fatigue, myalgia, and just muscle pain in general. So as far as availability, I did say they are fairly widely available as far as I know. And if if that's not accurate in your states, please do let us know. At least at the pharmacies, they are getting these in stock and they are starting to administer them. There is cost barriers, and I think the insurances are slowly getting up to speed with getting these getting these vaccines on their formulary. It does, both of them cost about $300, so they are fairly pricey. But I did get some good news today. I'd had kind of some mixed reviews from some folks that I had kind of informally polled, I guess, at how these were being covered. And I did hear from a pharmacist today that said Medicare D was covering a Brisvo, or at least the particular plan that they were billing. So that is the anticipated way that they will be reimbursed, is Medicare D. And there are still questions, and I've had several conversations this week with folks about how the facilities, the nursing home facilities, are going to be able to administer these vaccines if they're cost prohibitive. And there's not really a lot of specific guidance out yet from CMS on how they are going to be reimbursed as far as administration fee. I don't think that most folks that don't have an in-house pharmacy are able to bill Medicare D. Don't quote me on that if anybody is doing that. That is the way that they are going to be covered at this time. And I did also read that there was some push from kind of some leadership folks to also get it covered under B, but that is still just A or B. So that's still kind of in process, and there are probably going to be more clarifications coming out about that. So as far as the way that they are stored and the way that you have to administer them, they're both IM injections. They're both 0.5 milliliters, and they both require reconstitution. So the only difference between that reconstitution process, if you're actually going to be the first line person administering these, is that a Brisvo actually comes with a pre-filled syringe and an adapter that you use to, so the syringe already has the diluent in there, and then you hook that onto the vial. And then the Rexv comes in just your typical 2 vials with the reconstitution and the powder. And then the only other difference that I noted between them is a Brisvo, they both need to be used within 4 hours of reconstitution, but a Brisvo can be stored at room temperature and not in the fridge. And a Rexv has to be, it can be in the refrigerator or at room temperature. So just little kind of differences that I noticed as I was looking through the products. And when they studied these, they also found, as far as adverse events, rare occurrences of neurological events like Guillain-Barré syndrome, but that is inconclusive at this time. As far as the power of the studies, the number of patients that were in there, they weren't powered high enough to actually say that that it was related to the vaccine. So you might hear that, but no concrete evidence yet that that is an increased risk. Any questions so far? Thank you, Miranda, for putting all those links in there. All right, we can go to the next slide. I put this in here just for completeness. So they also came out with pediatric recommendations, I think just last week, for a monoclonal antibody that we can use in those babies in the first months of their life where they're at really high risk for RSV. So this is actually really exciting. And they are also looking at proposed approval for pregnant women to get this in the 3rd trimester of pregnancy to protect those babies. So that actually got added to the FDA's approval, like on the package insert for a Brisvo, but they haven't, the ACIP and CDC hasn't come out with that official recommendation yet, but I do anticipate that coming soon. We can go to the next slide. So next, pneumonia. So I know since recommendations have changed fairly frequently in the last well, ever since I've been practicing pharmacy, the recommendations I think have changed like 4 times for pneumonia vaccines. So I just wanted to do kind of a review. And actually, I would like to share my screen here to show those recommendations, because there's a really nice chart that the CDC has. So if you haven't seen this, and I will say my favorite way to determine, what appropriate pneumonia vaccine patients should get is the app or the web browser version of Pneumorex Vax Advisor, because it's easy, because you just put in all the stuff, put in their age, you put in their previous vaccination, and it just shoots you out what they need. And it's really easy. And really the recommendations were meant to be simplified. As you can see here, and this is just for patients age 65 and older, for their initial vaccine series. If we just carry PCV20, we're one and done, honestly, as Lori would say. And that makes it easy. But a lot of these patients, that haven't received it before or have received it before, maybe before age 65, or they just turned 65, and may have received some other vaccine when they were less than 65 because they had another risk factor. That's where it gets a little bit complicated. So essentially, if you have PCV20, you can give these folks 1 dose and they're done. If they've had a PCV15, they should also get a PPSV23 a year later. And kind of going through the prior vaccines that they've had. And then down here in this next section, if they've had a completed series, so that would be with the previous recommendations where they were supposed to get PCV13 and then PPSV23, it's up to the provider using the shared clinical decision-making process to see if they want to administer the PCV20. And it has to be at least 5 years since they've had that second PP, or the combo of PCV13 and PPSV23. And that was the recommendation for probably the prior maybe 3 years. So that's where a lot of people are at. So basically there are some strains that are covered in the PCV20 that wouldn't be covered by those other. There's a couple. And so that's where that recommendation comes, that you may optionally give that based on the patient's risk factors and history and things like that. So I'm only going to go through the top portion here, but if you go through this chart, you can go down to the younger age groups and see what schedule they need in the next couple pages. All right, we can go back to the slides. Okay, so that was the chart. And then the shared clinical decision making, we can go to the next slide. There's a nice 1-page handout that's for providers to help guide their decision if they want to give that basically 3rd dose of the new vaccine, PCV20. And this is just a 1-page handout that kind of goes through that decision-making process. And you see on here, living in nursing home or other long-term care facilities. So definitely a risk factor and a consideration when you're looking at your residents. And then I also, I just wanted to kind of address some of the prior recommendations. It used to be a long time ago that you had to get your pneumonia vaccine every 5 years. And that was for those patients that were older than 65, but that is no longer the case. So if they are 65, they've never gotten a pneumonia vaccine, they just need to get that one and then they're done. They don't have to repeat their vaccine. We can go to the next slide. And I will mention also, there was pediatric changes to basically incorporate the PCV20 into the pediatric vaccine schedule, but I am not going to go through those today in my presentation. So moving on, this is showing what folks may have been seeing in the media about this new EG5 variant, which is an Omicron variant that we're seeing as about 20.6% of all COVID cases right now. So as you'll recall, the XBB 1.5 is the version that the monovalent vaccine coming out this fall is going to be targeting. So you can see we've only got 4.7%, and we've already moved basically on by quite a few different variants. And this is a really good way to track data too, with the link here for, I think this is this weekly? I think it's weekly. It might be even more frequent than that. But the good news is, and we found this out this week, and this did come from the drug company, so keep that in mind, but Moderna came out and said that their monovalent fall vaccine is showing to be fairly effective against EG5. And I think they said FL 1.5.1. If we could go to the next slide, I think I have their statement there. Yeah, so this just came out. And so they're saying that that it is effective. They didn't give any percentages, of course, nothing detailed yet. But then, of course, to counter that, then Pfizer came out, because of course they're working on their version as well. And they said that they are also seeing promising results. So we will definitely keep our eye on this moving forward. But this is good news to say that we're going to have good coverage in the fall. Oh, somebody's asking, is there a way to get the names of the persons listening on the side? I can't see the screen. Maybe I'll defer to somebody that's more techie than me. And has
There is
Montana seen the...
if you look around the image that you're seeing, there should be two white lines on the, sorry, on the, I guess, right-hand side, midway up the page. You can put your cursor on that and scroll, or, you know, click and then pull it one way or the other to either increase the names or to increase the image that's on the slide, or image that's on the screen. Hope that helps.
Thanks, Miranda. So I saw another question about, has Montana seen these new variants? And I do not know the answer to that. Does anybody on the call know the answer to that? That is something we can put in our Q&As for next week. Okay. Yep. Okay. So we'll add it to our Q&As. That sounds great. Thank you, Holly. And then let's see, I saw another one here. So Novavax and Moderna and Pfizer are all coming out with new. Yes, all three companies are. Moderna came out with that statement. Pfizer kind of followed up. I haven't heard anything from the Novavax people as far as if theirs is covering the new variant, but I'm sure that will be coming soon. Oh, and I see Tori says they have detected one positive for the new variant in Montana. Okay, thank you so much. And maybe we'll maybe do an update for our states next week at where we're seeing the variant. That would probably be good. Okay, we can go to the next slide. So this is just something I wanted to point out to folks. This is something that's available on immunize.org, which is my very favorite website for immunization resources. It's like a comprehensive guide. It has all the products that are available, all the interim recommendations, everything that's kind of changing. They only update it monthly, so it won't be updated again until September 1st. But it is a nice resource, and I think it's like 3 or 4 pages that kind of goes through all the products. It gives the NDCs and the billing codes and all that kind of stuff too. We can go to the next slide. So this is just a list of the products that are going to be available. So this kind of goes back to the question earlier. They did actually put out NDCs and everything already as what's going to be available when they come. So I I pulled this from the Alaska Division of Public Health at their Echo series last week, and they're distributing this information if this is helpful for folks. And then as far as on the next slide, the flu vaccine recommendations this year, there's really not any changes from last year. The only kind of minor change was they said that if you have an egg allergy, you can get any approved product, and there's no like preferential recommendation for one that may be a recombinant versus an egg-based vaccine. But that's obviously going to be a decision that you make based on their history of egg allergy or reaction to a flu vaccine. But everybody 6 months and older should get a flu vaccine. They did continue with their preferential recommendation for this high dose and adjuvant formulas in those people 65 and older, because they do show higher rates of efficacy. All the formulas are quadrivalent as they were last year. And I know a question that comes up a lot is about them being preservative free. So really our only products that are not preservative free are going to be those multi-dose vials that have that kind of very small amount of thimerosal. And we can go to the next slide. This is a list. I'm sorry it got cut off at the top there. Miranda will put that link in chat for us. It gives you all the available flu vaccines that are going to be available this year and which age groups they're approved for, what the dosing is. So I think this is a really, really helpful chart as we move into flu season. We can go to the next slide. This is something that came out from that, the local epidemiologist. She put this together and posted it this week. I thought it was a really nice chart. It just kind of looks at each of the vaccines and the RSV antibody that we're going to have in our infants, and which age group and how effective they are and when to get it. And I don't think there's any really new information on here that I didn't already kind of cover in the individual portions, but it is a really nice visual to just kind of get a good picture of all the vaccines that we're going to be offering. Miranda, did I give you that link? Oh, I guess it's on the slide.
Yep,
Somebody
just dropped it in there.
Oh, yep, you did. I see it.
Says your local epidemiologist.
Yeah, I would suggest actually subscribing to her email newsletter too. It's really good. Lori says she's awesome. I love it. Okay, we can go to the next slide. So this is kind of the last thing, and I know we've mentioned this, I think previously, that there are several new tests that came out where we can actually test for influenza A and B, flu and RSV in one test, which is really cool. These are PCR tests. They do come back in about 30 minutes. One of them, and I don't recall which one, I think it was Expert. It said on their website that they could have a nurse come to your house, which I thought was interesting, and administer the test. So I don't know, that sounded kind of interesting to me, but probably not applicable to your populations. But these are something to have on your radar and something that we'll be able to use as we kind of see this triple demic happening last year and potentially this year as well. Did you want to add anything to that, Lori? I know you probably know more about them than I do.
No, that's a great summation. I think for those who can access these PCR tests, it's really nice to have one swab that does it all. All for our main respiratory viruses we see, especially in our elders.
Thank you so much. So the next slide, I just put some upcoming events here that you might want to tune into. There is going to be an RSV overview on the 30th. And then my favorite series, the Alaska Vaccine Echo, they're doing their next session, which is on September 19th, is going to be highlighting RSV as well. And then there's an on-demand training for COVID-19 vaccine that you can do at your own pace from the CDC there. And I have quite a few resources on the resource slide. If I wanted to call any out, the step-by-step vaccinating adults guide is really, really comprehensive. But it does, you can go in and like look by chapter. So you don't have to look at the whole 140 whatever page document. There's a vaccines with diluents. Looks like there was a typo there. That's really helpful. Frequently asked questions about RSV. And then the American Lung Association came out with some really nice resources kind of in alignment with the Immunization Awareness Month this month. So check those out. I like this RSV video from the American Lung Association. It's like 4 minutes and I thought it was really good. No questions? Nobody's going to ask if you can get COVID, flu, and RSV at the same time?
I don't think we want to ask that question, Kyla.
Well, I can say that I've looked at it pretty extensively at, the last week, and there are varied recommendations because folks are a little bit hesitant to say, yes, we can give RSV with these other vaccines. Folks, one doctor said, definitely separate them out. Somebody else said if patients are, and these are like doctors, you know, that were quoted or whatever, said, oh, you should give them all 3 if they're high-risk patients. So certainly the rules don't say we can't, but we don't have any specific recommendations from the CDC or really any other organization that's giving us solid direction. But we do have RSV available now, and we don't have the monovalent fall COVID available now. So that might make it easier to space them out. So they did say on the, see, that's somebody saying the RSV and flu can be given at the same time. So like I said, there's multiple opinions. I know the Alaska Echo folks, those people in the state, they came out and said, yes, give them together. But then I saw conflicting folks, I guess, health authorities and doctors saying that maybe you should separate them out. So Novavax said they don't have the data on all their tests were done at least 14 days. Sorry, it's blocking me to read that. We're done at least 14 days from a flu shot. Okay, so they're not going to come out and say for sure. So it's not a home test for the 4 viruses, unfortunately. But I would anticipate, I don't know if you've heard anything, Lori, that might be coming.
Yep, actually, and I think somebody asked me in a direct message in chat kind of a similar question. So it can actually be done at home, not by us, not as lay people, so to speak. But there are some mobile clinics, there are traveling nurses. There's a company that actually, there's probably more than one that does that. And so the machine kind of goes on the road to run it, so to speak. But it is not one like our COVID test that we have at home where we can run it ourselves, you know, swab and put it in the little tester. So not yet.
Thank you. So I see that Holly is saying, yes, they did say last year you could give COVID and flu together. And this year they're saying the same. It's just the 3 at once that hasn't really been given a solid guidance yet. So thank you. Well, I appreciate everyone's time today. I'm sorry I went over time. I didn't even think I'd be close to going over time. And we will hopefully next week for Q&A, we can maybe find out what the EG5 variant is looking like in all of our states, just so you have that information.
Next week, we'll actually be going over adverse drug events. Kyla will be speaking again with, if you guys remember, Jessie Kenny, who used to work with Mountain Pacific, but now works with Farm America. So she'll be back to present for us. And then if you guys can fill out that evaluation in the chat, we would really appreciate it.